Erectile dysfunction is a vital sign. When your erection changes, your heart, and sometimes your brain, may be asking for help. If it's sudden and comes with chest pain, shortness of breath, or neurologic symptoms, seek emergency care. If it keeps happening over weeks, get evaluated early. In today's video, we'll show exactly why erections fail, how to tell psychology from blood flow problems, what the research really says about pornography, and 6 practical steps to restore function. No hype, no blame.
Welcome to the Deep Dive. We're here to cut through all the noise and give you the clearest, most actionable insights. And today, we're tackling a topic that affects so many people, but honestly, it's often surrounded by silence, maybe some misinformation, difficulties with erections. Look, this isn't just some minor physical thing. It hits confidence, relationships, your whole sense of well-being, really. So our mission here is simple. Give you practical, action-first guidance, stuff you can actually use to improve erectile function. Think of it like a personal blueprint, maybe, for optimizing your biology. We have gone through expert sources, urologists, surgeons, to give you a clear roadmap you can start on, like today.
Exactly. And I think the main point is when you really get how erections work, and maybe even more critical, that connection between your body and your mind, that understanding, that's the key. It unlocks actionable improvements, not just temporary fixes. It's about, empowering you with real knowledge.
Okay, let's dive in then. Unpack the core mechanics. It's actually pretty amazing engineering, isn't it? When we talk about how an erection happens, what are the absolute must-know parts?
It really is amazing. Basically, an erection is a hydraulic event.
Yeah.
Simple as that. Inside the penis, you've got these 2 spongy cylinders, the corpora cavernosa. They're designed to fill with blood. And surrounding them, there's this really strong but flexible sheath called the tunica albuginea. And then, of course, you have veins whose job is to carry blood away.
Right.
Now, what's fascinating is how it all comes together for rigidity. The real, ignition switch is a molecule called nitric oxide. Think of it as the signal caller.
Yeah.
It tells the muscles in those spongy parts to relax. And that relaxation allows this huge surge of blood to rush in. We're talking oxygen levels nearly tripling in the tissue. That creates massive pressure, which is just essential for getting firm.
Okay, so blood rushes in. But it's not just about inflow, right? It has to stay there.
Precisely. That massive inflow creates pressure, and that strong tunica sheath, it expands, kind of like a really sturdy balloon inflating. And as it expands, it physically squeezes shut the veins that normally drain the blood, so the blood gets trapped. That's what creates and maintains the firmness. There's even a reflex involved, the bulbocavernosus reflex, that contracts muscles at the base, giving it like an extra firmness boost.
Okay, so if I'm getting this right, the big takeaway here is improving nitric oxide, getting good blood flow in, and having healthy nerve signals. That's fundamental. Flow and trapping. Got it. Now, one question we hear constantly is this just in my head or is something physically wrong? It's a super common concern. Are there simple ways to start figuring that out?
Absolutely. And it's a valid question. It helps to know there are actually 3 main types of erections. You've got reflexive ones from direct touch. Then psychogenic, those are triggered by mental stuff like thoughts or images. And finally, nocturnal erections, the ones that happen while you sleep. Each one gives us clues. Let's focus on those nocturnal ones, what most people call morning wood. If you're consistently getting strong morning erections, say 3, 4, maybe more times a night, especially during REM sleep, that is a really, really strong positive sign. It strongly suggests your basic plumbing, blood flow, nerves, hormones is likely working okay on a physical level.
Okay, that's huge.
It is.
Yeah.
Because it raises a key question. If you are getting good morning erections, but you have trouble during waking encounters, what does that suggest? Well, it points much more strongly towards a psychological or psychogenic cause. Things like performance anxiety, stress, relationship issues.
Okay. And that can kick off that awful psychogenic ED loop, right? Like you have one bad experience, maybe just an off night. Then you start worrying about it happening again. And that worry itself becomes the problem for the next time. It just spirals. It's incredibly common, that cycle. Stress hormones directly interfere with the erection process. So the worry literally creates the problem it fears. Another clue is consistency. If ED only pops up in certain situations, maybe with a new partner, but not when alone or only under stress. But other times, it's fine. That also leans towards psychogenic.
Right. So that stress piece, the performance anxiety, it's clearly a major player for a lot of guys. So where do we start? How do you actually interrupt that anxiety loop? What's the first, practical step?
Yeah, the good news is there are really effective strategies, and these mental tools are crucial, frankly, even if there is a physical component involved too. One really powerful approach is cognitive behavioral therapy, CBT. It's not just about thinking positive thoughts. It's more about learning to actively identify those negative, anxious thoughts about sex and performance, and then challenge and reframe them. It helps break that automatic spiral.
Okay, changing the thought patterns. Makes sense. Another excellent tool is sensate focus exercises. This is often done with a partner, but the principle applies. It's a step-by-step approach to touching and intimacy that deliberately takes erection and orgasm off the table initially. The whole focus shifts to just sensation, pleasure, connection. Removing that pressure to perform, it rebuilds confidence and dials down anxiety.
That sounds really helpful, taking the pressure off.
Absolutely. And of course, if there's underlying depression, anxiety, major life stress, treating that directly is key. They're strongly linked to ED. Sometimes, medication like sildenafil or tadalafil can even be used short-term, strategically, not as a crutch, but to make erections easier temporarily. This can reduce that immediate performance fear, help break the negative cycle, and build confidence while you're working on the CBT or other techniques.
So it sounds like tackling the mental side is always beneficial, regardless of the root cause. It empowers you either way.
Exactly. It's a crucial piece of the puzzle for almost everyone experiencing this.
Okay, we've hit the mental game hard, and that's vital.
Right.
But let's shift gears. What about the physical foundations? What can you actually do with your body to support firmer erections?
Right, the body tools. Physical activity is absolutely paramount here. Let's talk specifics. For aerobic exercise, the goal should be around 30 to 60 minutes of moderate intensity activity, let's say 3 to 5 times a week. That gets you to about 150 minutes total weekly. What's moderate intensity? Think brisk walking, you can still talk, but someone watching would know you're exercising. Cycling, treadmill, elliptical, swimming, all great.
Okay, 150 minutes a week.
Yes. And this isn't just general health advice. Studies show this directly improves blood vessel function and boosts that crucial nitric oxide production, the ignition we talked about. Interestingly, guys with more severe ED often see the biggest improvements from starting a consistent aerobic routine.
What about lifting weights? Does that help?
It does. Resistance training is also beneficial. It can help improve testosterone levels, which, while not the whole story for ED, certainly plays a supporting role. And think bigger picture. Exercise combats oxidative stress and inflammation throughout your body. Both of those things contribute to blood vessel damage and worsening erections over time. So you're cleaning house, basically.
That's a great way to put it. Okay, exercise is key. What about something even more basic, like sleep? I keep hearing sleep is underrated.
Oh, completely. Sleep is maybe the most powerful yet underutilized health lever we have, and is vital for erectile function. Think of a sleep upgrade checklist. 2 main things, quantity and quality. For quantity, aim for 7 or more hours nightly, consistently.
7+. Okay.
And for quality, it needs to be uninterrupted sleep. You need enough deep sleep and REM sleep cycles. That's when the body does its critical repair work. Good, consistent sleep significantly improves testosterone levels, helps regulate hormones, reduces stress. It benefits overall sexual function and mental clarity, too. It's truly foundational.
Right, it makes sense. Body needs to recharge. Okay, so beyond planned exercise and sleep, what about just daily life? Food, drinks, habits. How much impact do those have?
Huge impact. These are the lifestyle levers, and often the easiest things to start adjusting today. Let's start with food. The Mediterranean-style plate consistently shows up in research as being linked to the lowest risk of developing ED.
Mediterranean diet, what does that actually look like?
It emphasizes plant-based foods, lots of fruits, vegetables, whole grains, nuts, legumes. Olive oil is your main fat, so more healthy monounsaturated and polyunsaturated fats. Protein comes more from fish and poultry, less from red meat. And you're using herbs and spices for flavor instead of loading up on salt. The main idea. Focus on whole, unprocessed foods. Minimize the packaged processed stuff. It's good for your heart, good for your blood vessels, and good for erections.
Makes sense. Whole foods.
Then there's weight. If you're carrying extra weight, studies show that losing even just 5 to 10% of your body weight can lead to noticeable improvements in erectile function.
Wow, just 5–10%. That sounds achievable.
It often is, and it makes a real difference. For drinks, cut out the sugary drinks. Water, maybe diet drinks are better choices. Alcohol. The general guidance is less than 7 drinks per week. Honestly, newer data suggests limiting it even more for overall health, thinking about cancer risk too. Chronic heavy drinking is definitely bad news. It can lower testosterone and cause nerve damage.
Okay, moderation is key there. What about smoking?
Nicotine. If you smoke, Stopping is one of the single best things you can do, full stop. Smoking directly damages blood vessels and nerves. It increases ED risk by anywhere from 50% to over 100%. And yes, that vascular damage can actually lead to penile shrinkage over time.
Whoa, okay.
But the good news is quitting can reverse some of that damage, especially if you're younger. So quitting is urgent.
And recreational drugs.
Avoid chronic or heavy use. Amphetamines can double the odds of ED. Chronic cannabis use might damage blood vessels and lower T. And chronic opioid use. That can increase ED odds by like 8 times. These aren't trivial risks. Got it. Okay, now, the big one everyone asks about. Pornography. What's the real story there? Does watching porn cause ED?
Right, this is a super common question, and the answer is nuanced. It's not a simple yes or no. What large studies generally show is no direct correlation between just the amount or frequency of porn use and ED in the general population.
Okay, so watching it doesn't automatically cause problems for most guys.
Correct. However, it gets more complex. Certain individuals are at higher risk, guys who already have issues with depression, anxiety, high stress, or those who feel a lot of guilt or moral incongruence about watching porn. They seem to be more likely to develop psychogenic ED related to it.
So pre-existing mental health stuff makes a difference.
Yes. And then there's the habituation risk. If someone finds they only get aroused by specific types of porn and real-life intimacy doesn't do it for them anymore, or if they start preferring masturbation with porn over partnered sex, that specific conditioning can absolutely contribute to ED in real-world situations. It becomes a psychogenic issue driven by habituation. So the advice isn't necessarily stop watching porn, but more. Be mindful.
Exactly. Be mindful of your relationship with it. Does it feel compulsive? Is it replacing real intimacy? Are you becoming dependent on very specific stimuli? If you notice those patterns, maybe try diversifying your fantasies. Focus more on real-life arousal cues or take a break to recalibrate.
Okay, that's a really helpful, balanced perspective. Now, we focused a lot on lifestyle and mind-body stuff, which is great. But what about medications like the little blue pill and its cousins? Where do PDE5 inhibitors fit in?
Yeah, it's good to touch on them briefly. Their main job is to boost that nitric oxide pathway we talked about earlier. They make it easier for blood flow to increase and stay increased, helping achieve and maintain an erection. They're often used for ED caused by blood vessel issues, vascular ED. But as we mentioned, they can sometimes help break the anxiety cycle in psychogenic ED too.
But they aren't magic bullets, right? There are things to keep in mind.
Absolutely crucial things. First, you must talk to a doctor. These are prescription meds for a reason. They aren't right for everyone and can interact with other conditions or medications. Second, they don't fix the underlying problem. If you have high blood pressure, diabetes, or heart disease causing the ED, the pills might help symptoms, but you still absolutely need to manage those root causes for your overall health. And obviously, we're not giving any dosing advice here. That's strictly between you and your healthcare provider.
Right, crucial context. So putting this all together, beyond just sex, what's the big picture message here? Why is paying attention to erectile function so important?
It's incredibly important because ED is often like the canary in the coal mine for your overall cardiovascular health.
Canary in the coal mine? How so?
Well, think about the arteries. The ones in the penis are tiny, maybe 1 to 2 millimeters across. The ones supplying the heart are a bit bigger, like 3 to 4 millimeters. This means if you start developing plaque or vascular problems, those smaller penile arteries often get clogged or dysfunction first. So ED can show up years before you might experience heart symptoms, like chest pain.
Wow. So it's an early warning sign for heart problems.
A very significant one. There's data. If you get diagnosed with ED today, something like 15% of men might have a heart attack within the next 7 years. It's a serious wake-up call.
15%? That's sobering. It really drives home that this isn't just about sex. It's about survival, really.
It truly is. And it's not just the heart. ED is also correlated with cognitive performance. The brain needs healthy blood flow too, right? So if blood flow is compromised enough to affect erections, it might also be affecting your brain. One study found men with ED had a 68% higher risk of developing Alzheimer's or dementia over 7 years.
68% higher risk for dementia. Okay, this connection is undeniable. Erectile health is overall health.
Precisely. It's a powerful window into your systemic vascular and neurological health.
So, given how serious this can be as a warning sign, when should someone definitely seek professional care? And what should they ask their doctor about?
If you're experiencing persistent ED, it's really vital to see a clinician. Don't just brush it off or assume it's only stress, especially if it's a new or worsening issue. And when you go, it's smart to ask for some baseline health checks. Specifically, things like, Hemoglobin A1C that checks for diabetes or prediabetes, triglycerides and cholesterol levels, key indicators of cardiovascular risk, and an EKG, an electrocardiogram, to check your heart's electrical activity.
I1C, lipids, EKG.
Got it. Yeah, these are crucial screening tools to look for those underlying conditions that ED might be signaling. It's proactive health management.
Absolutely. So at the end of the day, improving erectile function isn't about one magic trick. It's really a journey of holistic health, isn't it? Mind, body, lifestyle, all working together.
That's the perfect summary.
Yeah.
It's about integrating all these pieces. So maybe we can boil it down to 5 key actionable takeaways, things you can literally start doing today or this week.
Yeah, let's do that. What are the top 5 actions?
Okay, number 1, prioritize sleep. Seriously.
Yeah.
Aim for 7+ hours of quality, uninterrupted sleep every night. Make it non-negotiable. Number 2, move your body. Get that 150 minutes of moderate aerobic exercise weekly, like brisk walking or cycling, and add in some resistance training, make it a routine. Number 3, eat for health. Shift towards that Mediterranean-style plate. Focus on whole, unprocessed foods, fruits, veggies, healthy fats, lean protein, less junk. Number 4, check your habits. Be honest about alcohol, limit it. If you smoke, quit now. That's huge. And be mindful of recreational drug use. And number 5, get checked out. If you have ED, see your doctor. Ask about those baseline checks, A1C, cholesterol, EKG. Treat ED as the important health signal it is.
Fantastic. Sleep, move, eat well, check habits, get checked out. That's a powerful starting list. And maybe a final thought to leave everyone with. Consider this, the way your penis works is actually a remarkably accurate indicator of your overall health. Think of your erectile health as a vital sign for your entire well-being. We really hope this deep dive has given you a clear, practical roadmap. Remember, this is all for educational purposes. It is definitely not a substitute for professional medical advice or care. Please talk to your doctor. Thanks for diving deep with us today.